Okay, when you hear the words blocked artery, your mind probably jumps straight to the heart, or maybe the legs, right? But what about your arm? It's a whole different ballgame, and honestly, it turns out to be a surprisingly complex and fascinating medical puzzle.
So what's the culprit? If you're thinking, oh, it's got to be cholesterol, plaque buildup, just like we see in the legs, well, you're not totally wrong, but you're only seeing a tiny piece of the picture. The real story is way more interesting. You see, with the legs, it's often a pretty straightforward story. But the arm? The blockages can come from a whole host of different and unexpected causes. For surgeons, it becomes a genuine mystery they have to solve. So let's dive into our first section here and really get a handle on this. We need to start by appreciating just how uncommon this condition, officially known as upper extremity arterial disease, really is. First off, this is a genuinely rare problem. We're talking less than 5% of all cases of what doctors call limb ischemia, which is just the medical term for a limb not getting enough blood. To put that in perspective, even at the biggest, busiest hospitals, surgeons might only see a handful of these arm cases compared to the constant stream of leg issues. And just look at this list. This is exactly why it's such a diagnostic puzzle. The cause could be an autoimmune disease, or maybe it's a structural problem in the shoulder called thoracic outlet disease. It could be from trauma, or even something super specific like hypothenar-Hammer syndrome, which is a repetitive injury some laborers get. All of a sudden, atherosclerosis, our usual suspect, is just one name on a very long list of possibilities. Okay, so we've got this long list of potential causes. But when someone comes into the emergency room with a sudden and severe blockage in their arm, what we call acute ischemia, there's one cause that is way, way more common than all the others. And that culprit is an embolus. The best way to think about it is like a rogue clot that breaks free, travels downstream through the bloodstream, and then gets stuck, creating a total logjam. And just like that, blood flow is abruptly cut off. So where are these rogue clots coming from? Well, check this out. A whopping 75%, 3/4 of them, actually start in the heart, often because of a condition like atrial fibrillation. The clot forms there, then takes a long journey all the way down to an artery in the arm. And where does that logjam usually happen? Well, the most common spot, about 60% of the time, is the brachial artery. That's the main artery in your upper arm. The runner-up spot is the axillary artery, which is up there right near your armpit. So the diagnosis is in, there's a blockage. What's the plan? Well, doctors have a whole toolkit of treatments, and picking the right tool for the job is absolutely critical. There's really no one-size-fits-all solution here. Really, it boils down to two main approaches. On one hand, you've got conservative management. This is for folks who might be too sick for surgery or whose symptoms are pretty mild. We're talking blood thinners, that sort of thing. But for most everyone else, the goal is to get in there surgically and physically clear that blockage. So why lean so heavily towards surgery? Well, there's a pretty compelling reason. A study from back in 1977 found something really stark. 75%, 3 out of 4 patients who were managed without surgery, ended up with an arm that just didn't work very well. And that's a huge deal. So if a patient is healthy enough, the choice is pretty clear. You've got to restore that blood flow. Now, the go-to procedure here is called a transbrachial embolectomy, and it's actually a pretty elegant process. The surgeon makes a small incision in that brachial artery. Then they slide a tiny catheter with a balloon on the end right past the clot. They inflate the balloon and just gently pull the whole thing out. But they're not done. They then run that catheter down the 2 arteries in the forearm, the radial and ulnar, to make double sure they're clear too. Finally, they patch up the artery, and they're done. You know that old saying, measure twice, cut once? Well, in surgery, it's check your work before you close. It turns out that doing an angiogram, that's basically a live x-ray of the blood vessels, right there in the operating room, makes a massive difference. By confirming the clot is 100% gone, they can take the rate of reblockage over 2 years from 12% all the way down to just 2%. That is huge. Okay, let's switch gears for a minute. We've talked about clots traveling from the heart, but what happens when the problem is direct trauma to the arm? This is a totally different scenario, and things can get pretty intense, pretty fast. So when we talk about trauma, it really splits into 2 categories. First, there's what's called iatrogenic trauma. That's a fancy way of saying an injury that happens accidentally during a medical procedure. And then there's everything else, what we call non-iatrogenic trauma. Car accidents, deep cuts, blunt force, you name it. One of the classic complications you see, especially from that iatrogenic trauma, is something called a pseudoaneurysm. The best analogy I've ever heard for it is a bubble on the sidewall of a tire. There's a small hole in the artery and blood starts to leak out, but the surrounding tissue kind of contains it, forming this dangerous pulsating sac of blood.
And the real danger here isn't just that it might rupture, it's about real estate. That growing sac of blood, the hematoma, starts pushing on everything around it. And in the tight quarters of the arm, it often ends up squishing the median nerve. The result? You can get serious nerve problems, pain, numbness, even weakness in the hand.
Now, this part is just fascinating to me. Where the injury occurs makes all the difference. If you block the big brachial artery up in the arm, that's a major problem, almost always needs surgery. But if you block the radial artery down by the wrist, most of the time the patient doesn't even notice. How is that possible? Because our bodies have this incredible built-in backup plan. The other artery, the ulnar artery, just picks up the slack and keeps the hand perfectly supplied with blood.
All right, so the surgery's done, the clot is out, the artery's fixed. We're all good, right? Well, not so fast. The next phase, recovery, has its own set of hurdles and long-term risks to think about.
And this is a big one. Check out this risk. If a patient who had an embolus doesn't go on blood thinners after surgery, their risk of having another one is 1 in 3, a 33% chance. That's why anticoagulation is absolutely non-negotiable. And even then, the risk doesn't drop to 0, especially if that original heart problem is still there.
For those more complex cases that need a full bypass, there are other things to watch out for. Using the patient's own vein is always the best option, way better than a synthetic tube. But surgeons have to be so careful not to injure the nerves that are literally hugging the artery. And even after a perfect surgery, there's still a risk the graft itself could clot off down the line.
Because at the end of the day, what's the goal here? It's not just about saving the arm. That's the baseline. The real win, the true goal of all this complex work, is to give that person back a fully functional, pain-free arm that they can use for everything they need to do day in and day out. It really makes you think, doesn't it? The story of the arm's arteries shows this incredible balancing act happening inside our bodies all the time. On one hand, we have these amazing, resilient backup systems. But on the other, it shows just how vulnerable we become when one of those critical pathways gets suddenly and unexpectedly overwhelmed.